Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
For those of you following along and have the handouts with you, I will give the slide number on the bottom, and so we're going to start with slide number 4. There are some specific things that we have to know when it comes to fracture care to make sure that we select the correct codes, not only from a CPT standpoint, but from an ICD-9 standpoint. And as you know, ICD-10 is around the corner, and we don't know how far that corner is right now because of CMS stating they might delay it, but we still need to start getting a handle on this. And this is an area that we do not have a very good handle on with having our providers document exactly where they are. When it talks about the location or classification, they're talking more about was it displaced, malaligned, non-displaced. And right now, from an ICD-9 and a CPT standpoint, we don't have to know that a lot. But when it comes to ICD-10, our codes are selected based on displaced or non-displaced, non-segmental, segmental, and those type of things. So we do need to get them to start saying that in their notes. The presentation, they need to be documenting whether it's opened or closed fracture, and then they need to be documenting again what their treatment is. How are they treating it? Just because it's an open fracture doesn't mean we're doing open treatment. So we want to make sure that we are very specific on that. On slide number 5, this is the area, the anatomic location of the bone. This is one of my biggest pet peeves is because of the fact they will say that they had a distal shaft tibia fracture, where there is no such thing as a distal shaft. The bone is divided into 3 parts. It's a third. You've got the proximal, the shaft, and the distal. Have to be very specific. I also get a lot of distal femur fractures. Well, that's really nice, but again, was it supracondylar, transcondylar, epicondylar, or was it just the medial or lateral condyle? If I don't know, I have to default to the smallest available unless the provider tells me. Very specific for both ICD-9 and CPT coding. On slide number 6, I've kind of given you a little bit of what it looks like when we talk about for ICD-10, and you can see that when it comes to our fracture care, that 7th character, which is an alpha, is based on whether or not it was a closed fracture or an open fracture. And some of our open fractures, especially in the forearm, they are based on the classification type 1, type 2, type 3A, 3B, or 3C. So we have to make sure that those providers using that area and also documenting it, that they actually tell us what types those are. You want to make sure that when we also come to classifications on slide number 7, are they talking about intra-articular or extra-articular, and how many fragments? We know for our distal radius fractures, those are key issues. If they don't state it, again, we're to default to the smallest available. We all know the saying, not documented, not done. This is a big difference in dollar amount and pricing, and so we need to make sure that they understand we need all this information. We need to know where it is and the details of it. On slide number 8, where it gets a little confusing is we all understand open treatment. Open treatment with or without internal fixation, percutaneous treatment. It's the closed treatment that at times causes us irritation and not sure how to bill for it, because there are really 4 options when it comes to closed treatment. There's that closed treatment without manipulation, then there's closed treatment with manipulation, then there's closed treatment with manipulation but with or without traction, and then we have the one that says itemized, which is kind of an a la carte, meaning that we can possibly bill out just as if it was a sprain strain. And so that's the area that seems to cause the most concern is how do I bill for those fractures where we didn't do anything, no manipulation. When it comes to open treatment, there are 2 definitions, and CPT in years past, they updated this because there was a lot of confusion as to what is considered open treatment. And part of the problem was, again,
Supercoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.